Welcome to the weekly Neurology Deep Dive, produced by Amer Gavanini. Today we're really getting into a topic that significantly impacts patients with drug-resistant epilepsy. It's the ongoing search for surgical solutions that are effective, but also less invasive. Specifically, we'll be looking at the latest large-scale data on laser interstitial thermal therapy for mesial temporal lobe epilepsy. It's a procedure gaining traction, and understanding its role is becoming pretty vital. Now, before we dive in, just the important reminder. This deep dive is purely for educational purposes. There's no commercial goal here. Think of this as a summary, and we strongly recommend you go back and read the full published paper for all the details. Okay, so for those of you needing the key takeaways right now, let's jump straight into the practical summary.
Absolutely. For the busy neurologist, here's the essence. There's a significant new study, prospective and multicenter, called LAANTERN. It looked specifically at laser interstitial thermal therapy for drug-resistant mesial temporal lobe epilepsy. Involved 145 patients across 15 centers. Key finding: at 2 years, about 58% of patients hit an Engel 1 seizure outcome. That's seizure-free or only rare non-disabling seizures. And about 57% achieved an International League Against Epilepsy 1 or 2 outcome, meaning really good seizure control. Clinically meaningful stuff. The procedure itself, generally well tolerated. Adverse events happened in about 17%, mostly mild, mostly transient. Importantly, permanent neurological deficits occurred in only about 5.5% of patients. We also saw improvements in quality life scores at nearly all time points measured, and the practical advantages are there. Short hospital stays, low pain scores when discharged, low readmission rates. So the findings really suggest laser interstitial thermal therapy can be considered a safe, effective option for these patients. Outcomes look comparable to open surgery, but it's significantly less invasive.
That's a very clear summary, really sets the scene. So our mission today is to unpack these findings from LAANTERN in more detail. We'll look closely at the data, the procedural aspects, safety, quality of life, and crucially, what this might mean for you in clinical practice.
Right. Let's start with the study design itself, LAANTERN, and who was included. It's a prospective multicenter registry designed for up to 5 years of follow-up. The data collection period ran from October 2015 to March 2023. It included both adults and pediatric patients defined as younger than 22 when they had the laser interstitial thermal therapy. All had drug-resistant mesial temporal lobe epilepsy, and all were treated at Level 4 National Association of Epilepsy Centers in the U.S.
And the scale is quite substantial. 145 patients, 15 centers. That gives the data some weight. And for 77 of those, we have the 2-year follow-up data we were just discussing. Demographically, about half were female, mean age around 39 years. And you mentioned pediatric patients. There were 14 in that group.
Correct. And looking at etiology, mesial temporal sclerosis was the most common, found in 74 patients, so that's a major group. The next largest group, 31 patients, had unknown etiology or their magnetic resonance imaging was normal. What's really important for context, though, is the level of drug resistance. About 72% of these patients had failed more than 3 anti-seizure medicines. So these were definitely tough to treat cases.
That really underscores the need for effective alternatives. And you also have the breakdown by race and ethnicity.
Yes. The study reported about 9% Black, about 82% white, and about 9% identifying as other races. For ethnicity, it was about 12% Hispanic and about 87% non-Hispanic.
Good to have that context for generalizability.
Okay.
Let's shift to the procedure itself. What did the data show about the practical aspects?
Well, the mean ablation volume, the amount of tissue treated, was about 28 milliliters, and the average surgery duration was around 4.3 hours.
In thinking about the patient's experience immediately after, recovery seems quite smooth based on the numbers. Mean blood loss was low, about 22 milliliters, and that median hospital stay of just 1 day is striking. The range was 1 to 3 days. Also interesting that about 23% didn't need an intensive care unit stay at all. For those who did, the median time there was about 22 hours.
And patient comfort, post-procedure pain, that's always a concern. The mean discharge head pain score was about 2.1 on that 0 to 10 scale. Now, that was statistically higher than their baseline pain, which averaged about 1.0, with a p-value less than 0.01. However, by 1 month post-surgery, the highest reported pain score averaged about 1.2, which was actually not different from their baseline. So it suggests any significant increase in pain is pretty short-lived.
And that ties in with the high discharge to home rate, about 97%. That speaks volumes about the recovery profile.
Exactly. Now, let's get back to the core efficacy, the seizure outcomes. As mentioned, for those 77 patients with 2-year follow-up, 45 of them, that's about 58%, achieved Engel 1 outcomes. And 44 patients, about 57%, reached International League Against Epilepsy 1 or 2 outcomes. These are strong numbers for this patient population.
And putting those numbers into context against historical controls is useful. You mentioned the comparison to the WEBA trial from 2001. The odds ratio for an Engel 1 outcome at 1 year in LAANTERN was about 18.5 compared to the medical arm of that trial. That's substantial. And comparing it to the surgical arm of WEB et al., the outcomes were actually quite similar. LAANTERN was around 61% Engel 1 at 1 year versus about 58% in the WEB surgical cohort. So laser interstitial thermal therapy seems to be holding its own against traditional open surgery in terms of seizure control.
It does, and perhaps one of the most surprising findings was what didn't predict outcome. The study found no significant association between seizure outcome at 1 or 2 years and various clinical characteristics. Things like having auras, the type of seizure semiology like focal to bilateral tonic-clonic, race, ethnicity, even having mesial temporal sclerosis, the ablation volume, or how long they'd had drug resistance. None showed a statistically significant link to outcome.
That's fascinating. It suggests our usual ways of predicting success might not apply quite the same way here. Makes patient selection potentially broader.
It possibly does, yes. It challenges some assumptions.
What about medications post-procedure? Any changes there?
Yes, that's another practical point. By 24 months after the laser interstitial thermal therapy, about 35% of patients had managed to either stop or at least reduce their dose of anti-seizure medication.
That's a major benefit for patients dealing with side effects.
Definitely. One other point on safety, specifically sudden unexpected death in epilepsy. The estimated incidence in this cohort was about 5.48 per 4,000 person years. Numerically, this is a bit lower than some other post-laser interstitial thermal therapy reports, but it is still higher than typically reported rates after resective surgery. Something to keep in mind.
Okay, let's talk more generally about the safety profile and adverse events. You said about 17% experienced one.
That's right, 24 patients out of the 145. And these were categorized by severity. 11 were mild, 12 were moderate, and 3 were severe.
Can you give some examples?
Sure. The most common mild event was actually clinically insignificant intracranial hemorrhage, tiny bleeds seen on imaging in 4 patients. For moderate events, the most frequent was an increase in seizure frequency, duration, or severity, which happened in 6 patients. Then the 3 severe adverse events. One was a fatal pulmonary embolism. Another involved postoperative bilateral middle cerebral artery infarctions, also complicated by pulmonary embolism. And the third was bilateral pulmonary embolisms, which led to intracranial hemorrhages. It's crucial to note, though, that the safety committee reviewed these severe events. They judged them to be risks associated with general brain surgery, not specific risks unique to the laser interstitial thermal therapy procedure itself.
That's an important distinction. And what about permanent effects from these adverse events?
Permanent changes were seen in 8 patients total, which is about 5.5% of the cohort. And that rate, about 5.5%, is lower than what's often reported for permanent deficits following open anterior temporal lobectomy.
So, again, reinforcing that potential safety advantage of the less invasive approach.
Correct. Now, shifting gears to quality of life. This is often just as important as seizure control for patients. And here the results were quite positive. They used the quality of life in epilepsy inventory. Improvements were seen at almost all the time points they assessed. Patients reported notable improvements specifically in areas like seizure worry, the effects of their medication, and social functioning. Interestingly, emotional well-being didn't show a significant change overall.
And does better seizure control directly translate to better quality of life in this study?
Yes, absolutely. Patients who achieved those Engel 1 or International League Against Epilepsy 1 or 2 outcomes had significantly better quality of life and epilepsy inventory scores at both the 1-year and 2-year follow-ups.
Makes intuitive sense.
There were also a couple of interesting findings when they looked at specific patient groups, or covariates. Hispanic patients actually showed greater improvement in their quality of life and epilepsy inventory scores at the 1-year mark compared to non-Hispanic patients. The p-value was 0.04. This difference seemed to be driven mainly by improvements in energy fatigue and social functioning. Another, perhaps counterintuitive finding, patients who had drug-resistant epilepsy for longer, specifically more than 6 years, actually had better overall quality of life outcomes after the procedure.
Any thoughts on why that might be?
The paper suggests perhaps those with longer-standing severe disease simply had more potential for improvement once seizures were controlled, a greater relative change.
That makes sense. What about the pediatric patients? You mentioned there were only 14.
Right, a small group, only 6, had the full 2-year follow-up. So Robust statistical analysis of their quality of life and epilepsy inventory scores wasn't really possible. However, numerically, they did show improvements in seizure worry, medication effects, and social functioning scores. Trends were positive, just limited by numbers.
Understood. So let's tie this all together. What are the main takeaways for neurologists in practice?
The core message, really, is that laser interstitial thermal therapy appears to be an effective and safe option for appropriately selected patients with drug-resistant mesial temporal lobe epilepsy. It offers durable seizure control, remember, about 58% Engel 1 at 2 years, and quality of life improvements comparable to open surgery, but it achieves this through a minimally invasive approach.
And the practical advantages seem clear, too. That short median hospital stay of 1 day is a big one, plus low 90-day readmission rates, around 8%, and minimal pain at discharge. These matter to patients and the healthcare system.
Exactly. And there was an interesting trend observed over the course of the study period itself. They saw a significant decrease in post-operative intensive care unit admissions over time. It went from about 88% of cases needing intensive care unit admission between 2015 and 2019 down to about 69% for cases between 2020 and 2023. That difference had a p-value less than 0.01. This likely reflects growing physician familiarity and comfort with the procedure's safety profile as experience accumulated.
That's a positive sign of procedural maturation. One final point the study touched on was disparities, right?
Yes, and it's an important one. The proportion of Black patients and Hispanic patients enrolled in LAANTERN was lower than the representation in the general U.S. population, according to census data. This really highlights an ongoing need. We need to work on expanding access to epilepsy surgery, including procedures like laser interstitial thermal therapy, and ensure research is more inclusive to improve generalizability and achieve equitable care for all communities.
A crucial point for the field to address.
So just to quickly reiterate that practical summary one last time for everyone listening, the LAANTERN study gives us strong prospective evidence supporting laser interstitial thermal therapy for drug-resistant mesial temporal lobe epilepsy. It's safe and effective. About 58% achieve seizure freedom, Engel 1 at 2 years, with significant quality of life benefits. It's well tolerated, short hospital stays, low pain, low rate of permanent deficits. So for you, the neurologist, this data supports considering laser interstitial thermal therapy as a really valuable, minimally invasive option when discussing treatments with appropriate patients.
That provides a fantastic overview and practical understanding of this important study, and to leave you, our listeners, with something to think about. We know patients often strongly prefer minimally invasive options. With this growing evidence, like the LAANTERN data, supporting the effectiveness and safety of laser interstitial thermal therapy, how might this start to reshape our very first conversations with patients when they're considering surgery for drug-resistant mesial temporal lobe epilepsy? Thank you for joining us on this weekly neurology deep dive. Remember, this is for educational purposes only. Always refer back to the full published paper for the comprehensive details.